this is Carolyn Robinson. I'm going to be recording my Mantoux skin test for tuberculosis for my lab checkoff in nursing school. All right, so let's get started. So first off, we are going to check our physician's orders and grab all the supplies that we need. So I have my Injectaderm right here, and I also have a 2x2 gauze pad, alcohol prep pads, and my tuberculin syringe. So we're also going to make sure that we are in a well-lit area for testing, and we are going to read the vial label as we remove it from the refrigerator and inspect the vial for the expiration date and the date the vial was opened. If it's a new vial opened, we're going to write the date and our initials on the label. And then we are going to perform hand hygiene. And then next we are going to go to our patient. Hi, I'm Carolyn Robinson. I'm going to be your student nurse for the day. Today we are going to be applying a Mantoux skin test to test for tuberculosis. It should only take about 5 to 10 minutes. You will notice a little wheal in your skin. It's an intradermal injection, and then you will need to come back within 48 to 72 hours to get your TB skin test read. Is that okay with you? And then I'm going to confirm the correct patient using 2 patient identifiers, usually name and date of birth, and then ask about their tuberculin skin test history, along with any allergies, and provide any education that the patient might need. And then we are going to perform hand hygiene again and position the patient's arm correctly. So you want their forearm out with the palm side up, and you are going to choose the site that's about 2 to 4 inches below the elbow. And then we are going to apply gloves and clean the injection site. And we are going to use our alcohol prep pad in a circular motion, starting at the site and working outward several inches in a circular motion. Okay, and then we would clean the vial and allow it to completely dry, which this one's a new one, so we could use it, but I'm still going to go ahead and clean it. And then we are going to allow that to completely dry and grab our needle. And we are going to make sure that this needle is tightly on the syringe. And then we are going to inject air into the empty space of the vial once that alcohol dries. Okay, and then we are going to withdraw a 1/10 of a milliliter. And we are going to lightly tap and make sure that there's no air bubbles in the syringe. Okay, and so we're going to make sure that we expel all of the air or extra of the solution or TB skin test from the needle, leaving the correct amount, which is 1/10 of a milliliter. And then we are going to stretch the skin taut over the injection site, and we are going to insert the needle bevel up at a 5 to 15 degree angle. And then you want to make sure that you can still see the needle right under the skin. And you are going to inject the solution, forming a wheel of about 6 to 10 millimeters. Okay, and then we're going to remove the needle without massaging that spot, and activate any safety device, and discard the syringe into a sharps container. And then if any minor bleeding occurred, we would dab the injection site gently with our cotton ball or 2x2 or our cotton swab or our 2x2 gauze. And then we're going to perform hand hygiene again, and we are going to record the date, time, location, injection site, name of the manufacturer, the lot number, expiration date of the the PPD solution, and our name as well. And then we are going to instruct the patient not to mess with the injection site, and we are going to explain any normal reactions that they might have, and also inform the patient about the importance of returning within 48 to 72 hours. And we would also make sure to give them a written appointment card with the date to return. All right, so now for our results. To read a TB skin test, we are going to gather and prepare any necessary equipment or supplies, which is going to be a millimeter ruler to measure the induration. So you'll walk in. Hi, I'm Carolyn. I'm going to be your student nurse. I'm going to be reading your TB skin test today. I'm just going to lightly touch your arm and let you know the results of your TB test, or to find out the results of your TB test. It should only take about 5 minutes. Is that okay? Okay, and then we'll make sure that it's the correct patient with the name and date of birth, and we're going to thank them for letting us do this and perform hand hygiene. I've already explained the procedure, and we are going to inspect the patient's arm in a well-lit area on a firm surface. And then we are also going to locate the site of injection with the patient's forearm supported, slightly flexed at the elbow. And we are going to touch lightly with the pads of the fingertip and sweep fingers in 2 in diameters from the injection site in all 4 directions and locate any edges of induration. We are also going to use a zigzag feather-like touch to palpate for induration as well. And then we are going to repeat the palpation with the patient's arm raised at a 45-degree angle. And we are going to move fingertips toward the injection site without lifting, locating induration with fingertips resting firmly against the induration margin. We are going to use a ballpoint pen to mark the widest edge of the induration from thumb to pinky finger and with a fine dot, and then we are going to locate the induration on the other side of the patient's forearm and place the second mark on the margin of the induration. We're going to palpate again, repeat the finger movement toward the site of injection. And we are going to adjust the dots if necessary. We are also going to use a millimeter ruler to measure the diameter of the induration. And we're going to do that perpendicular to the long axis of the forearm. We're only going to measure the induration, not any erythema. We are going to place the zero ruler line on the inside of the left dot edge and read the ruler to the right dot edge. And then we are going to correctly record the exact measurement in millimeters. And we, on the Mantoux tuberculin skin test record form, and we are going to record the date, the time the test was read, our name along with our signature, and any presence or absence of any adverse reactions, which could include blistering, swelling, or redness. We are also going to explain the significance of a positive or a negative skin test result to the patient, and we are going to direct the patient to follow up if necessary, so if it's positive. And then we are going to provide documentation, a copy of the skin test record form, and we're going to provide that to the patient and explain the importance of us giving that information and then retaining it. And then we are going to provide culturally and linguistically appropriate educational material to the patient as necessary. So my patient had a 0 millimeter induration, but they also they had a smallpox vaccine on June 1st of 2020, and they received their skin test on the 28th of June. So with smallpox vaccines, if they receive one, they have to wait a month before they get a TB skin test. So in this case, the skin test was invalid and should not have been performed. It should have been waited a couple of more days to a week, just to ensure that that full month had been processed instead of 27 days. So this could be a false negative, and we would need to repeat that skin test after that month had fully passed. All right, so I'm going to thank my patient and thank you, and have a great day.